Hi, everyone. Welcome to the 2022 Healthcare as a Human Right General Meeting. My name is Nathan Rodkey. I am one of the co-chairs of the steering committee. It's an honor to be here with all of you and an honor to introduce April Sims, Washington State Labor Council President-elect, for many reasons, but I guess I just want to say this. It's an honor to introduce her. As in labor, she is the first Black woman to hold office at the level she's at, and that makes me really proud to introduce her. So take it away, April.
Well, thank you so much, Nathan, and good evening, everyone. It's a privilege to be here. Again, like Nathan mentioned, my name is April Sims. My pronouns are she and her. I currently have the privilege of serving as Secretary Treasurer of the Washington State Labor Council, AFL-CIO, and now President-elect, which I am very excited about being sworn into office in this position in January of 2022. I want to welcome you all to tonight's meeting. And just to lift up a little bit about the Washington State Labor Council for new folks who maybe are joining, we are the umbrella labor organization in Washington State, representing over 600 locals and affiliates and the interests of over 500,000 working folks all across our state in every sector, every corner, and every industry. And we proudly boast having the third highest union density in the nation. So at nearly twice the national average, 20% of Washington workers are represented by a union, which means 1 in 5 of us is represented by a union. That also means 80% of our workforce is not organized or not represented by a union. So we've got some work to do. And we look forward to doubling down on our organizing work moving forward. I want to start by grounding myself and acknowledging the land that we are on. I know that we're not able to meet together, but no matter where you are on Indigenous land, the traditional lands of our Indigenous brothers, sisters, and siblings. I want to recognize that I'm on Coast Salish territory, joining you from the traditional and unceded lands of the first people of Seattle, the Duwamish tribe. And I honor with deep respect and gratitude their elders, past and present, for their stewardship of this land and its people. I thank them for the privilege of living and working on their land. I also want to acknowledge that mine is a legacy of stolen people on stolen land. So I raise my voice in the struggle for Black liberation and the movement for Black lives, and would invite you all to take a moment and join me in considering the many legacies of violence, displacement, migration, and settlement that bring us into this space, and hope that you will consider uncovering these truths at your meetings and events moving forward. I'll pop some resources in the chat in just a moment if you're interested in learning more about the land you're on and how best to acknowledge the ancestors and the keepers of that sacred space. Thank you for allowing me to do that. Before I kick this meeting over to the facilitators, I just want to recognize that we know that in the United States, we have the highest costs of healthcare in the world, and that cost is rising at a rate that's higher than incomes, right? And that these costs impact workers both at the bargaining table and families in our communities. And we're proud of the partnership that we've had with Healthcare as a Human Rights Coalition. And in 2022, delegates at our convention passed a resolution calling on us to convene our labor leaders and groups and discuss how we prioritize and engage in this work moving forward. So we are looking forward to having those conversations with other stakeholders and other union members, and coming back to this space and really having a conversation about how we do meaningful work together moving forward. So thank you for the opportunity to introduce myself and the opportunity to kick off tonight's meeting. And I think I'm turning this over to Nathan, David.
I'll take it real quick. We're going to pass it to Gina and Cheryl. They are our MCs tonight. Thank you very much, April.
And I am Gina Owens. I am part Alaska Native, so I am an enrolled member of the Haida Tribes, the Alaska Corporation. Because of lived experiences, I have dedicated roughly 20 years, 2 decades of time advocating and lobbying on healthcare and housing issues. So along with Washington Can sitting on the board, I was also appointed in 2019 to sit on the Seattle Renters Commission as co-chair, focusing on the intersectionality of how healthcare can affect a person's housing situation. So that's a lot of the work I do. I'm going to turn it back over to you, Nathan. Thanks.
Cheryl, did you want to introduce yourself really quick?
Oh, okay. Thank you. My name is Cheryl Wapes'a-Mayes, and I serve on the Healthcare as a Human Rights Steering Committee as a rep for the Tacoma National Organization for Women. I am an educator at Chief Leschi Schools at the Puyallup Tribe, and I am an enrolled member of the Assiniboine Sioux Tribe at Fort Peck Reservation in Northeast Montana. And my interest in universal health care stems from having watched family members struggle financially over medical bills while barely surviving on disability. My daughter has MS, and her husband was diagnosed with a degenerative brain disease. And this is why I feel so passionate about this. And I am honored to serve with such amazing advocates for universal health care.
Thank you so much, Cheryl. Now, we want to talk a little bit about victories, and go over the agenda. Gina, take it away.
We fight for the healthcare policy because every one of us is fired up by our lived experiences with our inadequate healthcare system. Let's take a moment for those of you who are now new to HCHR to give you a quick overview of our coalition. Healthcare is a Human Right Washington, to be known as HCHR, is a grassroots community labor campaign formed in 2013 to secure the fundamental right to healthcare for all individuals in Washington state and our nation. We're part of a growing movement for health justice. We've won some important victories along the way and are in a stronger position than ever to advance toward universal, affordable, and equitable healthcare in our state while we continue to press Congress. Cheryl?
Thank you, Gina. Tonight, we're going to highlight some historic labor wins that are crucial for our movement. Then we will spotlight 3 2022 key victories for the Public Employees Benefits Board, federal wins in the Inflation Reduction Act of 2022, and an update on Washington drug prices, and give an overview of other areas of our work. And then we will review and vote on proposals for the 2023 HCHR policy agenda and our 2023 budget and membership dues. Please submit your questions in the chat about these proposals.
Let's go to WSNA first.
My name is Julia Barcott, she and her. I am the Washington State Nurses Association Labor Cabinet Chair. And I also am an ICU nurse that work at Astrea-Toppenish Hospital on the Yakima Nation Reservation down here. And I drive almost an hour to work because I want to serve served and culturally diverse populations that don't get medical care otherwise. I'll start with Astrea-Toppenish. We were the lowest paid hospital in Washington State, and 30 of our 80 nurses had quit. We were able to get through some really good negotiations, some insurance coverage reimbursement, and a 20 to 34% wage increase over 3 years for our nurses. We had gone through bankruptcy and a closure of the Yakima sister hospital. Because of that, and because nurses always talk to each other, Seattle Children's was going through a picket at that time. So I called up my friend Edna and told her what we got, and they were able to get, put pressure on their employer to get $10 over, $10 an hour raise over a year, plus a number of new bases and what amounted to a really high raise for newer nurses, which bumped up the senior nurses as well. Central Washington and Wenatchee also got a 16% over 3-year raise with a $1,200 ratification bonus. And the Astoria Sunnyside, the other Toppenish partner, had retention bonuses and a almost 13% wage over 3 years, and were able to open back up their wages and meet the Toppenish hospital wages as well. A number of other hospitals in Wenatchee, CHI Franciscan, St. Clair and Lakewood, Evergreen Kirkland, Benton Franklin County Health District, Ocean Beach and El Waco, Providence, Sacred Heart, Whidbey Island, Peace Health St. Joe's in Bellingham, Arbor Health in Morton, and Peace Health Island in Friday Harbor were able to get really big increases as well. I say with sadness today that the same thing is happening to underserved populations, because we were called by our employer in Toppenish at 9 o'clock to come to a 9:30 mandatory meeting, and we all live an hour away that work there, and they are shutting the labor and delivery because it's not making enough money for them. We have served people with really high risk OB and have very specialized nurses that work there. So once again, the rural hospitals that serve the underserved are closing because they're not profitable. Would you like to continue, Lynette?
Sure. I just was going to touch base with some legislative things that we're working on, knowing that you folks are going to be working beside us, helping lobby for many of our issues. Number one issue, short staffing. We know that. We know it nationwide. Our American Nursing Association is sharing that with us also. We need to go in. We need to get very strong language, and it needs to talk about ratios. So hope to see you beside us as we go into different offices. Thank you.
Perfect timing. Cheryl's 4 minutes are just up. So Gina's up for 4, if I'm reading this right.
I believe it's Cheryl for SEIU 1199 labor win.
Yeah.
Yes, SEIU is next, and that's Cheryl.
Okay, so to get started, we wanted to highlight historic healthcare worker contract settlements. It's been a huge year for labor, and we want to celebrate these hard-fought victories and our support for healthcare workers. We start with the struggles of healthcare workers to be paid living wages that increase racial equity and to have staffing levels that are safe for both patients and workers. Our state is blessed to have a strong healthcare unions that have demonstrated their strength in tough contract campaigns during the pandemic. This photo shows the power and unity of the 2019 strike by Swedish Providence SEIU 1199 Northwest healthcare workers that led to even more gains in an early contract settlement in 2022.
Well, on behalf of the Retired Public Employees Council, I want to give a big thank you to, a big thank you is due to the coalition members of the Healthcare as a Human Right. Working together, you helped save a traditional Medicare plan for retirees covered by the Public Employees Benefit Board, PEBB. The monthly cost for 2023 coverage for the Uniform Medical Plan Classic Medicare enrollees was increasing by $73 a month, while premiums for the Advantage plans were not changing significantly. Also, there was a proposal to totally eliminate the Uniform Medical Plan Classic Medicare as an option starting in January 2024. One of the PEBB board members even expressed the opinion that the state had a fiduciary responsibility to not offer such an expensive plan. RPEC's representative on the PEB knew of RPEC members concerned about saving traditional Medicare, as there had been controversy concerning signing on to the ACO REACH letter. So she sent the word out. From there, everything exploded, with many of us appalled at the thought of being forced onto an Advantage plan, thereby supporting the privatization of Medicare. With the help of the Puget Sound Alliance for Retired Americans, the Federation of State Employees, the Alliance for Retired Americans, Social Security Works, Washington Education Association, and the American Federation of Teachers, and the Senior Citizens Lobby, word spread quickly about this proposal. This resulted in over 300 attendees via Zoom for the June 30th PEB meeting. The proposal to eliminate the Uniform Medical Plan Classic Medicare as an option for 2024 was postponed. And since then, promises have been made to not eliminate it in the future. Now, RPEC's Executive Director, Lori Widner, is leading the effort to work with the Healthcare Authority to make sure that there is follow through with having listening sessions, which will enable enrollees to have knowledge about the plans readily available and to have opportunity to ask more questions. So again, thank you to the coalition members. Working together, you helped save the UMP, Uniform Medical Plan, Medicare Classic Plan, the plan preferred by the vast majority of retirees. So thank you, thank you, thank you.
Thank you, Gwen. HCHRWA was pleased to be a part of that coalition formed to retain traditional Medicare for our state's public service retirees. HCHRWA, through several meetings directly with Senator Murray, Senator Cantwell's staff, and members of Congress, along with several direct actions, helped lead the statewide grassroots movement to folks in Washington. I want to highlight a few things in particular. For a time in this process, Senator Murray, who is the chair of the Health, Education, Labor, and Pensions Committee, was notably silent on the importance of RX negotiations for Medicare. This immediately shifted following a HCHRWA action outside her office at the federal building, in which we made the demand that she take a strong stance on RX negotiations. Shortly after that action, her staff reached out to show us a video in which Murray spoke in front of her committee after that action, taking a stance that she would fight for RX negotiations. In the end, it took not only us, but partners all across the country to make the grassroots voices heard so that we could achieve this victory. And now today, I have the pleasure to update you about the Inflation Reduction Act. Let me start by saying Americans pay 2 to 3 times what people in other countries pay for medications. After much advocacy across the country, the Inflation Reduction Act finally addresses this problem by allowing Medicare to negotiate prices for high-cost drugs. Other highlights of the cutting costs section are capping insulin copays at $35 monthly and capping Medicare beneficiary out-of-pocket costs in Part D program at $2,000, among other things, but those were the highlights. Under the lowering premiums, expanding coverage category, there's 2 main highlights I want to note. Hundreds of dollars per person are saved on the marketplace healthcare premiums. And approximately 52,000 more Washingtonians will have health insurance next year, 2023. My closing thought is the most impressive for me and hopefully all of you. Narrow disparities in healthcare coverage and access to care. Continuing the ACA improvements will reduce uninsured rates for all demographic groups, but the uninsured rates will fall disproportionately for the Black community. for me, that's a big deal because I am a person of color. So knowing that we're inching towards it, but moving towards Blacks and communities of color getting healthcare, that's a big deal. So I like that. So,
Gina, it's a 30-second warning.
okay, so now we're about to hear from Maddie Johnson, the chapter leader of Washington Insulin for All, a HICR sponsoring member organization. Maddie, are you here?
Hi there. Thank you so much, Gina.
Wonderful.
Hi, everyone. Thank you for having us today, and thank you for being supporters of Washington Insulin for All and the work that we do. My name is Maddie, and I am the volunteer chapter leader for the Washington State Insulin for All movement. I'm here to share a little bit about the successes of 2022. And we couldn't have done it without the support of all of the organizations that are on this call today. So I know I heard Gina mention a $35 insulin copay cap. Well, I'm here to say Washington did it first. Earlier this year, we passed the SB 5546, which extended our insulin copay cap and reduced it to $35. So that was very exciting for our chapter. Also included in that bill was the continuation of the insulin affordability work group. So that group has been meeting this year and is working on bringing together a recommendation to policymakers on what it would look like to have an emergency insulin supply or some kind of insulin purchasing program. So part of SB 5546 was including some kind of emergency insulin program to be determined by the work group. So we're excited that that's in the works. They're talking about that, and we're looking forward to seeing the recommendation from the insulin work group. We know that emergency insulin supplies are life-saving, and we're grateful that lawmakers are taking the steps to implement some type of emergency supply access. That was just this past year, and we're looking forward to next year too, and looking forward to collaborating with everyone on this call. Much shorter than 4 minutes, so I'll give that back to the meeting, and thanks everyone.
You have almost 2 minutes to go.
Thank you, Maddie. It's so exciting to see movement on making insulin affordable and accessible, isn't it? We have one last HICR event we want to highlight, our voter education and registration cookout in Auburn. Apollo, Washington CAN, and Pacific Islander Health Board wanted to reach out to young BIPOC voters. It speaks to HICR's intention to be multi-generational and connect with communities of color. Our cookout was a blast. I was there, I know. Washington CAN registered several new voters. Many of them were young people. And I must say here that one of them was actually my youngest granddaughter, who is 19. Lika Smith with Pacific Islander Health Board set up a table to distribute several different necessities for people who needed them, like baby formula, diapers, face masks, hand sanitizer, and more. We even had a visit that day from then candidate King County Prosecutor Lisa Mannion. And I think there were more pictures, but these on the slide really represent the voter registration table and Lika handing out the supplies. So that was a great event.
We've been very happy to welcome new members into our coalition this year, strengthening our community and labor characters through strong relationships with organizations and leaders in BIPOC communities and the labor movement. So we would like to welcome the Coalition of Black Trade Unionists, Puget Sound chapter, LELO, Legacy of Equality, Leadership and Organizing, Save Secular Healthcare Washington, Hand in Hand, the Domestic Employers Network, and Project Access Northwest. As we go into 2023, HCHR is 64 organizations strong, representing hundreds of thousands of supporters. HCHR is composed of 42 sponsoring organizations and 22 allied organizations. Please reach out to us to suggest organizations or to explore membership for your organization. Now let's turn to 2023. The HCHR Policy Committee co-chairs Emily Brice, Senior Attorney and Policy Advisor for the Northwest Health Law Advocates, NOLA, and Sam Hatzenbeler, Senior Health Policy Associate for the Economic Opportunity Institute, will walk us through our 2023 policy agenda.
All right, thank you, Cheryl, and great to welcome the new members and review our victories this year. So really exciting to see everyone. I see a lot of familiar faces from the policy committee, so thank you so much. And as Cheryl said, I'm Sam Hatzenbeler, Senior Policy Associate with the Economic Opportunity Institute, and also co-chair along with Emily Brice of the Policy Committee for Healthcare is a Human Right. So we can get the slides up and start going over our goals and our policy agenda. Our agenda is really developed with a lot of input and feedback. Emily and I are certainly not the experts on all of these issues. Many brilliant policy committee members have brought forth proposals for us to consider. It's an iterative process, so we really take our time and go through and try to think through every bill or budget item that gets brought forward and put it through our filtering criteria, which I'll go over in a minute. Keep in mind that as bills and budget proviso items come forward in the coming weeks, new items may be added throughout the coming weeks. So this is our platform as it stands now. So first I'll go over our goals, and we adopted these a couple of years ago to help focus our work, and we keep fine-tuning them. So I'll just go over them here. We have 4. The first one is our North Star to achieve universal health care in our state and our nation. Number 2, improve healthcare affordability and access while driving down escalating industry profits and controlling prices. That's much the same as last year, but we added the controlling prices element this year to make sure that we really hold large, wealthy health system industry entities accountable for the prices they're charging us that make it so difficult for us to afford care. 3, advancing equity and addressing social determinants of health. With that particular focus on reducing racial disparities, we know that this is really critical to building a system that is based on care, not greed, and the way racism functions in our healthcare system is continuing to be a major barrier to our work. So that's a particular focus there. Number 4, last but not least, defending access to healthcare through existing public programs. And this includes fighting off privatization and monopolization as we work towards a universal system. Next slide, please. Go over our filter. So we use these 3 questions whenever we're considering a policy item. Does the issue enhance and support the mission and goals of healthcare is a human right, pertaining to the goals I just mentioned? Does the issue have a critical mass of advocates, including core membership in HCHR, Healthcare is a Human Right, who are leading on this issue? And number 3, is there a clear and realistic strategy to pass or adopt the policy item? All right, next slide, and we'll get into the state agenda here, and then I'll pass it over to Emily, who's going to go over federal and non-legislative stuff. All right, so we've got them in buckets here. Goal number 1, remember that's our universal coverage goal. So I'll share some examples of what we mean by this. So the first piece, support state action to advance universal healthcare system. One piece we're pushing here is funding to support 2 full-time staff to support our state's Universal Healthcare Commission. So that's backfilling really important staffing capacity to support the commission there. Next one down, advance immigrant health equity. As you may remember, earlier this year, last session, the movement to remove barriers for immigrants being able to access healthcare really made some important victories. And one of those was winning administrative funding and the go-ahead for a pathway toward a Medicaid look-alike program, so that our undocumented friends, family, and neighbors are able to get the same Medicaid type benefit that our citizen folks are who are low income. So that's one piece. And then the other victory was getting authorization for applying for a federal, it's called a federal 1332 waiver, which would enable undocumented people in our state to buy coverage on the state marketplace. And if you haven't heard it yet, just last week, we heard that our waiver is approved. So Washington now is the very first state in the country that is enabling undocumented people to buy coverage on the exchange, on our state marketplace. So this is a major, major, major victory, and just huge thank you and huge congratulations to everyone who has worked on this. I know many people on this call worked on that. So that is really, really key. And also that win of getting that approval means that folks in our state, the undocumented folks, will be able to receive the subsidies that are already now available for people up to 250% of the federal poverty level. So to move this forward in the coming year, we need to make sure that it is fully funded and fully implemented and ready to go in time for 2024. So there is some funding in the governor's budget that was just released today. Still evaluating numbers on that, but yeah, so that is a major priority for us this coming session. And then last in this bucket, improve Medicare affordability and benefits and access. We want to make sure that we address the Medicare affordability cliff so that when people become eligible for Medicare, their costs don't skyrocket and their benefits don't get worse, which is the situation we are currently in. So that's an important piece to focus on there. Okay, so that's goal one. Exciting. Goal number two is, as I said, improving healthcare affordability and access. So the pieces under this one want to really go after hospital contracting, make sure that there is no anti-competitive behavior that's allowed. So we're expecting to see a bill coming down targeting hospital contracting. This is really especially key for consolidations. We know that when major hospitals continue to buy up a lot of the market, they are able to really set prices at whatever the market will bear. Read bad for patients, bad for affordability. So that's one. Next one is improving drug affordability. We really want to make sure that our new prescription drug affordability board is able to have the authority to really go after high-priced prescription drugs. So this PEBB 2.0 bill that we're expecting could help to give the board more authority to do that. And then last in this one, really wanting to make sure we support our healthcare workers. We know there, even before the pandemic, there was a massive workforce shortage. It got a lot worse during the pandemic. So we want to make sure that we support our healthcare worker comrades and who are really holding up our healthcare system. Can't have a strong healthcare system without strong workers who have good pay and safe working conditions. All right, so we'll take a breath and go to the next slide. We'll go over the last two goals. Thank you for the tech folks. Okay, so next one here, advancing equity. One aspect you'll notice this has been on our platform for several years now, improving access to care with community-based care. So we want to see dental therapy move this session. And Children's Alliance and others are really doing great work leading on that one. We know that oral care is critical to building overall good health. So that is a key one there. We've really built out our platform on abortion and reproductive care this year, particularly in light of attacks happening at the federal level and all over the country. So shout out to Northwest Reproductive Freedom Coalition for their work on this. Got a number of bills that they're helping to move forward. Keep Our Care Act. You might remember that one about addressing mergers and acquisitions, consolidations, SHIELD law, Consumer Health Data Privacy Act, abortion access funding. And these are all kind of aimed at making sure to protect patient privacy, protecting abortion providers, and really making sure we have enough funding to make sure that we can make sure that anyone in our state or people coming from out of the state who are seeking abortion care, so that we have services available to people. All right, and then last on that bucket, we know we can't really afford all of the basic things that we need, including healthcare, without making sure that our revenue system is more progressive. One way to do this is by passing a wealth tax. This has been put forward in years past as well, and Balance Our Tax Code is one coalition working on this, many folks working on this. And the wealth tax is a 1% tax on intangible assets, which is stocks and bonds and other things like that, which is a big way that wealthy people have their wealth, right? It's not just income, it's a lot of intangible assets like stocks and bonds. So this 1% tax would tax intangible assets over $1 billion, 1 billion with a B. So we know that's really important to make sure our wealthy neighbors are paying their fair share. All right, and then the last goal here for state stuff, defending access to care and staving off privatization. Want to make sure that we are continuing to support our current public affordability programs, such as Cascade Care. You'll remember that this one is related to our to a previous priority that HICR has supported, and Cascade Care Savings Program is a premium subsidy program that helps people under 250% of the federal poverty level afford their coverage on the exchange. So some money in the governor's budget was just released today, just a couple hours ago. So looking forward to digging more into that, finding more details. But yeah, so Cascade Care. And then last but not least, strengthening our behavioral health system. One piece of this is thanks to NAMI for bringing this forward. The 988 crisis line noticed that Governor Inslee's budget also included, I believe, about $100 million to support this. And this is really helping to strengthen our workforce and crisis line training for crisis responders. All right, so I know that is a lot of information. You can tell the policy committee's been busy, and I don't think anyone could accuse us of lack of ambition. So I'm going to pass it over to Emily, who's going to go over federal and non-legislative items for our policy agenda. Emily.
Thanks so much, Sam. And we're running a little behind, so I'm going to try to talk fast, but we do have a lot to get through, and there's so much to be excited about on a state level. On a federal level, the outlook is a bit more mixed given the divided Congress. So we're going to have to walk and chew gum at the same time. We will have to work hard to advance progressive healthcare priorities while also playing defense against what are sure to be attacks from the Republican-led majority in the House. We recognize this work is a long game, so we're going to keep pushing on our North Star priorities, and also there might be opportunities along the way to make more targeted change, as there was this past year with the Inflation Reduction Act, and we will seize those opportunities and reflect that balance. Of course, we start with our universal health care priorities, which are carryovers from the previous years. And I'm just noticing, I think we need the next slide, please. There we go. Okay, so we start with our universal healthcare priorities. We have bills we have seen before here. Rep. Jayapal and Bernie Sanders Medicare for All bill vehicles. we know that those might not pass this year, but we want to keep up the movement, and we could potentially make progress in the meantime on the State-Based Universal Healthcare Act, which has been a Repcon bill that allows states to more readily combine multiple waivers, which are requests states can make to seek flexibility from federal law. Sam mentioned that Washington just received approval for our first 1332 waiver, a groundbreaking proposal. So we are well on our way to exploring waiver opportunities, and that bill could give us even more flexibility in Washington towards universal coverage and care. But as we work to make that big picture progress, we know there are a lot of folks suffering on unaffordable healthcare right now. And that brings us to our second goal, which, as Sam said, has a dual focus on improving access to affordability help and also driving down prices and profits. We're going to see what comes out of the 118th Congress, but one important and known priority will be standing in solidarity with folks around the country whose states have still not expanded Medicaid under the Affordable Care Act. It's well over a decade later. That's an issue that disproportionately impacts people of color, people in southern states that are being held hostage by their own states. And it's not acceptable. It's not acceptable that there are still states like Georgia where Congress hasn't delivered a coverage solution for low-income people who are struggling. So that didn't make it into this Inflation Reduction Act, despite Senator Warnock's efforts, and it needs to be a priority for this Congress, and would propose that we stand in solidarity with those other states. Next slide, please. So turning even more squarely to equity, we wanted to make sure our federal platform reflect the need to address inequities in our healthcare system. Some of those inequities are longstanding. For example, federal restrictions like the 5-year bar that have kept even lawfully present immigrants from affordable health coverage since the welfare reforms, quote unquote, of the 90s. Rep. Jayapal has been working on this. She's been working on a solution called Lift the Bar Act, and we want to support those common sense measures. And then sadly, of course, as Sam mentioned, we need to step up our efforts to address inequity for people who can become pregnant, given that Dobbs decision that rolled back Roe v. Wade, and swift action in many states that are not Washington to ban or severely limit abortion care. This is going to be challenging given the divided Congress, but we need to take every opportunity we can to make sure that people can get safe care for the full range of services that they need during a pregnancy, including abortion. So we've got some bills on there to speak to that need. And I do see a question in the chat, which I hope that we can get to. So I'm going to keep rolling around, and then we'll take questions in a moment. Finally, we want to make sure that even as we advance Medicare for All concepts, we're shoring up the kind of Medicare program we'd all be glad to join. In recent years, our Medicare system has been straying further and further from the government-administered system it was meant to be in 1960s, given the proliferation of for-profit Medicare Advantage plans, increasing profit-driven mechanisms creeping into original Medicare, such as ACO REACH. And we expect that given the Republican-led House, there might be even further attacks on Medicare that go beyond that this year. So we want to make sure we protect against any efforts to weaken benefits, eligibility, or long-term funding that underlies the Medicare program in the trust. That's the big picture on federal agenda. Next slide, please. I'll wrap it up with a discussion about non-legislative items. So we want our platform to recognize that some of the most important policies take root outside the legislative or congressional arena in the day-to-day, sometimes boring work of boards and commissions and agencies. And starting last year, our platform has included a set of non-legislative items that we're monitoring, weighing in on when the opportunity arises. We've got a long list here. Folks in our group have been busy. That extend to pursuing universal coverage through Washington State's Universal Healthcare Commission. That group is starting to really bear fruit, and it's really important to support that and move the nascent recommendations and action that's happening there forward. We already mentioned defending original Medicare against further privatization. This would be important in the administrative arena with federal agencies. In addition to that, we have state bodies like the Healthcare Cost Transparency Board, Prescription Drug Affordability Board that are beginning to take action on looking at the underlying drivers of healthcare prices and potentially taking action to stop excess prices. And we've got, again, an important state body in the total cost of insulin work group at a state level that is taking a look at what is driving those skyrocketing insulin costs and what we can do to continue to make sure that people have access to life-saving treatment across a variety of measures. Finally, and I know this is a lot, but we need to, in all of our efforts in these government bodies, to be supporting increasing leadership presence and opportunities for community of color and healthcare governance. That means when we put in our recommendations for who should be sitting on those boards, we are thinking about that hard and really thinking about representational leadership. And last but not least, at some point, our public health emergency is going to end. That has been in effect since the beginning of the pandemic. And that wind down process is going to be painful. And there's really an opportunity that for things to go awry for the many people who have had their Medicaid coverage and other coverage expansions protected during the pandemic. So
Emily, this is just your 1 minute warning.
Okay, well, I will do better than that and wrap up right then. And let folks ask questions in the chat. I see one question from David about nationalizing Medicaid to take pressure off state budgets. That is a very interesting question, David. I haven't seen a proposal come forward on that front that we've been able to take a look at in the policy committee. So I haven't seen a bill or a proposal take shape, but would obviously welcome thoughts on that, and that goes kind of across the board. If there are new proposals that people become aware of or are working to develop, we would welcome you to come into the policy committee and share that information, talk through the filtering questions that Sam mentioned around kind of what strategies can we cook up together to move that forward. So I don't know if Sam would have anything she'd want to add to that or others, but you know, David, that I'm a big Medicaid fan, so.
This is the 1 minute, I mean, the end of the 1 minute of that 20-minute section for Cheryl and Sam. I mean, for Sam and Emily.
You're a good Mo. Thank you.
Yeah.
Bevan, I'm seeing some chat. That's great. Check in with Schreier. Thank you. I love this group's ideas and connections. Does anybody else have questions on the pieces that Sam and I proposed? I think we have a minute or two for questions, and we did share quite a bit, but I also know that folks have been watching these policy pieces over the last month or so, and sharing feedback along the way. So I hope that they look familiar to you.
I'll also jump in and say that everyone is, if you're not already, welcome to come to our policy committee meetings, and feel free to, I'll put my email in the chat here. You're welcome to join us every other Tuesday, and we'd love to have your ideas and proposals and dialogue. So yeah, looks like Kristen.
Sure. I was curious about the SHIELD law, particularly if that included a sanctuary for families of trans children who do receive some gender affirming care in other states, let's say Texas and Florida, and then those authorities try to go after them in Washington state, but then they seek quote unquote sanctuary here in our state from being brought there. So I was curious if the SHIELD law provided for family members beyond healthcare providers.
That is a great question, Kristen. I haven't heard that the bill that's being contemplated includes that yet. Maybe you just gave someone an idea. I know that we have a couple folks on who are working on that. So if you would want to pop in the chat to answer that question, would welcome that. And it's also something that we can keep on our radar.
Sure. I think there are only 3 states in the country that have such a sanctuary law. I was watching something and I was like, oh, Washington's not one of them. And so that popped up in my head. And I remember that Rep. Drew Hansen was very passionate about shielding health providers and sort of providing a place. But I was like, well, I've heard mostly healthcare providers. I didn't quite hear yet about the families. So appreciate anybody who has some information on this. Thank you.
Thanks so much for sharing. And that's an issue that affects my own family. So I appreciate you sharing that out. Propose that we move into the next section. And it's my pleasure to introduce our HCHRWA Steering Committee member, Jim Howe, who represents the American Federation of Teachers Washington. And Jim's going to conduct our voting process for us tonight.
Thank you, Sam and Emily. And let me put in my plug for being on the policy committee. They do great work there. Before we commence with voting on the policy agenda, this is the first of 2 votes we're going to do tonight. Let's explain how voting will work. 1 designated voter from each sponsoring member organization may vote on our policy priorities. Because we are meeting remotely, we have to hold roll call votes. I will call by name of the organization and the designated voter. It'll mostly be in alphabetical order, but there's a few exceptions. We know that some members may need to abstain or decline to vote on in favor or against on particular issues because they or their national affiliate have not endorsed particular bills. Finally, we want to be able to be sure to say that we know that some of our member organizations do not have the scope or capacity to work on all of the issues in our state and federal platform. The value of our coalition is that we are stronger together and can bring our combined voices to advocate for common purpose. In that spirit, we hope our proposed platform meets with all of the members' approval. So there is there's the example of if you have to abstain on a piece of it, that will be one way you can vote. You can vote yes, you can vote abstain in part, you can vote no, or you can abstain from voting on the entire proposal. So, and I'll repeat back to you how you voted as we do that. David Loud, do we have a quorum?
Presente, yes. I'm so happy to announce that of our 42 sponsoring membership organizations, 40 are present with designated voters.
Wow.
A quorum is 28 out of 42, and we have 40 present.
Thank you, David. Do we have a motion? Ada Lynn, do you have a motion?
Yes, I move that Hickory Washington adopt the proposed 2023 Hickory Washington policy agenda in the document that's just been presented.
And do I hear a second?
This is Gina Owens. I second that motion.
With the second, I open the floor for discussion. Please raise your hand in the Zoom reactions.
Isn't a potential increase for corporate profits under all ACOs, not just REACH, different than calling this privatization? They are still supplements to traditional Medicare, correct?
Thanks, Mo.
Okay.
Well, I'm certainly not an expert on ACO REACH. Jackie, I appreciate your question. I know that our federal policy experts have been working hard on this one. I do know that the Congressional Progressive Caucus is really taking this on as a priority, and we've been in touch with Rep. Jayapal's office on this, and just that there's a huge movement across the country trying to work on this issue and call it out. That I know that the Medicare Trust Fund is getting paid to manage these plans, and then they keep the money that they don't spend on care. And so that's kind of the background that I know. And also people are really being added to, Medicare enrollees are being added to these plans without their consent. And then facing a lot of problems if they try to get off of them. I don't know if David or anyone else wants to add, but I'd certainly welcome you to come to policy committee meetings, and we can really help kind of dive into this. It's really a meaty issue.
I just want to say that I'm going to be abstaining on this particular portion because of some positions of the Alliance for Retired Americans. And one of the things that we are concerned about is the confusion by calling it privatization. Allowing corporate profits to increase and siphon money out of the healthcare system is a valid concern, and fighting against it is valid, but calling it privatization is different because every supplemental plan is paid for by the Medicare Trust Fund. This money is coming out of the Medicare Trust Fund. So it's really confusing when you call it privatization because it's all about a change in the fee structure. And really, that's the conversation that should be happening, in our opinion, is around capitation versus fee for service. That's the situation, and calling it privatization really is damaging to the understanding of all retirees about what's private and what's not in the Medicare system. So anyway, I just wanted to make sure that I was able to sort of explain some of our concerns.
Thank you, Jackie. Are there any other questions? Then let's, for the sake of time, let's move towards the vote. Oh, Sarah Weinberg.
Sherry.
Yes, I just wanted to answer the issue about the use of the term privatization. What these Medicare Advantage plans and now various things in the ACO are doing is they are using capitation to take Medicare trust fund money into private hands and keeping it. That's what privatization means. I guess we could simply call it corruption if you want, but I think their goal is to drain the trust fund so that the Medicare program will cease and will be back to private insurance for everybody. So I don't want to be that alarmed about the term privatization and get into the fact that it is Medicare money that is being spent. What it's being spent on is private corporations. Enough.
What I'm hearing, this is Emily, thank you so much for that dialogue, because what I'm hearing is actually consensus, it sounds like, on policy concerns, but differences in terms of communications and language that we use to talk about some of these issues. Important differences, because language has meaning in the policy space. But I'm glad that we got to have that dialogue a little bit, because it will help us reflect on how we talk about ACO REACH and how we talk about the specific concerns, because not everything about an ACO or is necessarily a concern, but the specific concerns that are at issue here. So I think this has been helpful.
Thank you, Emily. And this is something that can be handled in the policy committee before actual language. Okay, I believe we have a motion to adopt the HCHRWA policy agenda, and so I'd like to start the voting. As I said, it'll mostly be in alphabetical order by organization. However, there's one or two exceptions, and that is because we have a couple of members who are voting for two different organizations. So we'll lump those together whenever we can to do that. So the first one I have on here, and please unmute if it's your turn to vote, is the Alliance for a Healthy Washington, and that's Bevan McLeod.
Bevan McLeod here, voting aye. Thank you.
Thank you. That's an aye vote, a yes vote. I'm going to skip for a reason down to Pro-Choice Washington. Sammy Aloy, how do you vote?
Pro-Choice Washington votes aye.
That's an aye vote. The American College of Nurse Midwives, I believe there's no one here today. Is that true, David?
That's right.
Okay. The American Federation of Teachers, and I am voting for them, and the American Federation of Teachers votes yes. Apala Seattle, Amy Leong.
Apollo votes aye.
And while you're here, Amy, Lilo, the Legacy of Equality, Leadership, and Organizing, how do you vote?
Leela votes aye.
All right, the Asian Counseling and Referral Service, Michael Bion.
ACRS votes yes.
The Backbone Campaign, David McClanahan.
The Backbone Campaign votes yes.
And while you're here, David, PNHP.
Physicians for a National Health Program, Washington votes yes.
Thank you. Another yes vote. The Carolyn Downs Country Doctors Community Health Clinics, that's Michael Craig.
My organization votes yes.
Thank you. A yes vote. The Children's Alliance, Cassidy Christopher.
Children's Alliance votes yes.
The Coalition of Black Trade Unionists, Claude Burfitt.
Coalition of Black Trade Unionists vote yes.
And also the NAACP, South King County, also Claude.
Seattle King County NAACP also votes yes.
Thank you. A yes vote. The Community Health Network of Washington, Hawa Elias.
Hi, I'm voting for the Community Health Network of Washington, and we vote yes.
Doctors for America, the Washington chapter, Nancy Connolly.
Doctors for America votes yes.
The Democratic Socialist Alliance of Tacoma, Tracy Murphy.
Tacoma DSA votes yes.
Thank you. A yes vote. The Economic Opportunity Institute, Sam.
Economic Opportunity Institute votes yes.
The Faith Action Network, Kristen Eng.
Faith Action Network, Fan votes yes.
Healthcare for All Washington, Ronnie Shore.
Healthcare for All Washington votes yes.
The League of Women Voters for Washington, Jody Disney.
League of Women Voters of Washington votes yes, but abstain on the federal portion.
The Machinist District 751 Retirement Club, Jackie Bosha.
We vote yes and abstain on the federal portion.
The Washington State Alliance for Retired Americans, Wasara, also Jackie.
We vote yes and also abstain on the federal portion.
The National Organization of Women in Tacoma, Cheryl Wapes'a-Mayes.
National Organization for Women Tacoma chapter votes yes.
And the National Organization for Women for Washington State,
And
Cheryl.
Washington State chapter also votes yes.
The North Seattle Progressives, that's Mo Brinkland.
Yes, Maureen Brinkland here for North Seattle Progressives. We vote yes.
The Northwest Healthcare Health Law Advocates, Emily Brice.
Northwest Health Law Advocates votes yes.
The Pacific Islander Health Board, Lika Smith.
I don't think she's here. She is not here.
Okay. The Pride at Work, Mike Andrew.
Pride at Work votes yes.
Pasara, David Loud.
Yes, yes, yes.
All right, page turn. Retired Public Employees Council of Washington, Gwen Rench.
Vote is yes.
The Save Secular Healthcare Washington, Susan Brooks Young.
Yes, Save Secular Healthcare Washington votes yes.
CMAR Community Health Centers, Jesus Sanchez.
CMAR votes yes.
Seattle Indivisible, Paul Oldenkamp.
Yes, Seattle Indivisible enthusiastically votes yes.
SEIU 1199 Northwest, Ada Lynn.
My organization votes yes.
Okay, the Somali Health Board, I believe Mohammed Shadain, he had to leave, take care of a problem with children, and he did both text and call in and voted yes on this. So we'll record that as a yes vote for the Somali Health Board. UAW Local 4121, that's Sam Sumter.
We vote yes.
Washington Insulin for All, Jessica Alston.
Washington Insulin for All votes yes.
Thank you. It's a yes vote. Washington Community Action Network, John Godfrey.
Washington CAN votes yes.
Washington Federation of State Employees, Cindy Hall.
Washington Federation State Employees votes yes.
Washington Poor People's Campaign, Ming Chen.
Washington Poor People's Campaign votes yes.
The Washington State Labor Council, Civil.
Hi, I'm here with this baby. Who's being a little bit grumpy, but letting me talk, thankfully. So yeah, some new friends. We are voting yes, but abstaining on the federal pieces due to our national.
Thank you. And finally, for this vote, the Washington Working Families Party, Margaret Carey.
Yes, Washington Working Families Party is an enthusiastic yes.
Are there any sponsoring organizations that think they should have voted? Then I believe that's it. You're gonna have to give the team just a few minutes to tally the vote.
My recommendation, because we're behind on time, Jesus, if you're ready, I recommend that we skip the waiting for this and go straight to Jesus if you're ready. And then I can announce the vote after Jesus is done presenting.
Okay.
Thank you.
I'll be happy to go ahead and get started, Nathan. Thank you.
Thank you very much.
Okay. Well, good evening, everyone. I'll be presenting both the sliding dues scale proposal and the budget. And we'll be asking everyone to vote for both the sliding dues scale proposal and the budget, because I believe that without one, there's not another. There isn't a budget, so I believe it's inextricably connected together. So there's something I think that we should vote on as a group. But more importantly, before I get into that, I just want to share, that HCR has relied mostly on the sweat equity of sponsoring member organizations and on intermittent financial donations to cover our modest expenses over time. So in this, we also, but when you look at that, we've successfully raised funds for particular expenses by ad hoc funding. And basically what that means is we relied on the goodwill and the support of many of you over a long period of time. But as we get closer to the kinds of things that we need to really focus on, in particular, some of the policies and the platforms that we're working towards has been mentioned already, we have a fundamental, I think, a commitment that we need to make with respect to supporting a strong communications program. So when you see the budget, which I'll show in a few minutes, the budget is really based, when you look at it, it'll be 70% of that is going to be going towards communication, because that's really the key linchpin that we think is important in our endeavor to continue to make these platforms reality. So as we move it forward, the dues proposal will have a sliding dues scale proposal that you'll see based on, and basically it'll show that in the budget sheet when we move to the budget sheet. But I also want to share something, and I've shared it with a couple of you before, but I think it's important to talk about it very quickly here. And I come from a farm working background. My family of migrant farm workers. We lived in labor camps in the early years in the Yakima Valley, and we recognized the need for healthcare, but we couldn't afford it. And my mother, when she broke her leg at 62, all of us were absolutely ecstatic when she broke her leg. And I know it sounds weird, but it's because we didn't want her to work anymore, but she kept working because she couldn't afford the healthcare. So she wanted to continue working. We took care of her over the years, but when she finally had community healthcare clinics, such as CMAR and Yakima Valley Farm Workers, she got healthcare, preventative care, which is something that was unheard of. We usually went to the doctor when we were at death's doorstep. So it's so important that we get the message, the kinds of things that we're moving forward in the 23 platform is critical and needs to be upheld by the kind of communication that we're going to need to do to push in 2023 this platform in a very effective and efficient manner. So the budget proposal that we're going to be proposing to you today is very modest. And when I look at modest, honestly, this is probably one of the most modest budgets I've ever seen. And I know that as we talked about it in the policy committee and in the budget committee, we know that it's not a lot, but when you think about what has happened in the past few years with just a support of volunteer support, not only on the sweat equity side on sponsor member organizations, but also on the giving that has been done on an ad hoc basis, the amazing work that has been done and accomplished is just, to me, beyond comprehension. And it's amazing. But with a more predictable budget, we can do a heck of a lot more. So on a predictable budget, this is what we need going forward in the 2023 and the years beyond, is to have that fundamental, what I call anchor in making sure that we achieve the kinds of successes that we have and continue to improve in the directions that we're moving, which is the kind of platforms that we're proposing at this point in 2023. So the sliding dues scale, I think, can you move that, Nathan, to the sliding due scale? Okay, so the scale here, that's the budget actually, but can you move it to the scale? There we go. So on the dues scale, proposed 2023 membership dues, we suggested the following sliding scale sponsorship minimum levels for membership levels: 1,000, 750, 500, 250, and 150. But when we obviously right here, we won't turn away an organization. We suggest that organizations consider their current participation in HCHRWA Washington committee work, look at their organization size and budget and donation policy to decide which level is appropriate for yourselves. For organizations for which the dues options are a barrier, then other forms of support can be considered. That, of course, when we turn to sweat equity, when we look upon the kind of level of support that you've given us over the years and continue with that, needs to be given because it does have value. And sweat equity does have a very strong value, as you've seen all the work that's been done in the past. So this is the membership dues is being proposed right now. I mean, this is the direction we would like to go with. Again, just underscoring the policy organizations with respect to the dues is to take a look at it to see, based on your organization size and budget and your donation policies that you have within your organizations, to decide which level is appropriate for yourselves. Nathan, could we take it to the budget? Okay, on the budget this year, it's a very modest budget of raising, our goal is to recommend raising $12,000 for our 2023 work. And we also have a carryover of $1,912.23 on hand currently over to the following year. The steering committee is looking at $2,500 for the steering committee to be working on this, $8,500 for communications, which is 70% of the budget, and $1,000 for the organizing committee. We can talk about what those mean in terms of dollars, but I think it's pretty evident on the $8,500. What that means is really taking a look at how we can move the needle forward with communication, because it is an important piece for us. The total budget is $12,000 for a total of for that total budget for 2023. I don't know if there's any questions. I've not seen anything here at this point. Does anyone have any questions regarding the budget themselves or what the steering committee or communications or organizing committee would be doing? Okay, well, at this point, then, Nathan, I think we should take it to the next step. If there's no questions, then I would move it to a vote. Is someone going to be asking for the motion, or should I ask for the motion for a motion?
If it's okay with you, I'd like to move that HCHR Washington adopt the 2023 HCHR Washington budget and organizational sliding scale membership dues proposal.
I, Claude Burfict, second that motion.
Okay. Kelly Powers makes a motion. Claude Burdette, Burfict makes the second. Is a second. Is call for the question.
All right, with that second, and the call for the question, then we'll start the voting. Was there any other reason not to start? Okay. Nation, should we announce the first vote?
Yeah. If you have that in front of you, you can, or I can do it. Oh, no.
I do. Oh, go ahead. Go ahead.
All right. So first, thanks so much, everybody, for being here and for voting. For the national or federal agenda, we have 36. Let me say that really clearly. 36 yeses and 4 abstentions. And for our state policy agenda, we have 40 yeses and 0 abstentions. For the record, to make it clear, we have 0 no votes. So that is all of it for the policy agenda. Thank you very much, Sam and Emily, and for Jim and everyone for helping us get through this process. And yeah, let's get to the votes for the for the budget.
Okay, I've been given a little change here. So for the budget and dues proposal, I'm gonna start with Jesus
Yes,
at CMAR Community Health Centers.
yes, you have a resounding yes for me. And personally for me, I'm going to make a personal donation as well of $1,000 to the committee on my own. But the answer is yes.
Thank you. That's a yes vote. And then I'm going to jump, for those following along, down to near the end to the Washington State Labor Council for Sybil to vote. Or your proxy.
Was that a yes vote?
Sorry, I didn't have time to calm her down before it was our turn. Yes, we approve. Thank you so much.
Okay.
Thank you.
The next one I had here was Margaret. And Margaret, who are you representing?
Yes, Working Families Party of Washington says yes. Thank you.
Okay. And then also Jody. And I'm jumping around myself, so.
Yes,
Jody.
yes. We approve League of Women Voters of Washington.
Oh, League of Women Voters. Okay, thank you.
Yes.
So that's a yes vote. All right, I will go back up to the top of the alphabet and ask for the Alliance for a Healthy Washington. Bevan.
This is Bevan and I vote aye. Thank you.
Okay. I believe the American College of Nurse Midwives has still not shown up, so we'll skip that. The American Federation of Teachers, this is Jim Howe, and I'm voting yes. The Apollo Seattle, Amy Leong.
Paula votes yes.
And while you're there, LELO, the Legacy of Equality, Leadership, and Organizing, Amy.
Leela votes yes.
The Asian Consulting and Referral Service, Michael Bion.
It looks like he had to leave.
Okay. Then we'll go to the Backbone Campaign, David McClanahan. How do you vote?
The Backbone Campaign votes yes. And I also am the representative for Physicians for National Health Program, Washington, and we also vote yes.
Thank you. Carolyn Downs Country Doctors Community Health Centers, Michael Craig.
We vote yes.
The Children's Alliance, Cassidy Christopher.
Yes.
Thank you. That's a yes vote. The Coalition of Black Trade Unionists, Claude.
The Coalition of Black Trade Unionists, Puget Sound votes yes.
The NAACP, Seattle King County.
Yes.
Another yes there. The Community Health Network of Washington, Hawa.
I think she had to leave.
Okay. The Doctors for America Washington chapter, Nancy Conley.
Votes yes, thanks.
That's yes. Okay. DSA Tacoma, Tracy Murphy.
Tacoma DSA votes yes.
Thank you.
Could I just mention that Tracy and Jesus both served on the budget committee that helped us put this together.
Thank you, David.
Serve on the budget committee.
The Economic Opportunity Institute, Sam.
Economic Opportunity Institute votes yes.
Okay, the Faith Action Network, Kristen.
Yes.
So yes. The Healthcare for All Washington, Ronnie.
Healthcare for All Washington votes yes.
Okay, the Machinist District 751 Retirement Club, Jackie.
We vote yes.
Okay. And the Washington State Alliance for Retired Americans, Jackie.
Wasara votes yes.
Okay. The National Organization of Women, Cheryl.
National Organization for Women Washington chapter and Tacoma chapter both vote yes.
Thank you. North Seattle Progressives, Mo.
Yeah, this is Maureen Brinkland for North
Maureen.
Seattle Progressives. We vote yes.
Northwest Health Law Advocates, Emily.
Northwest Health Law Advocates votes yes.
Okay. Lika's still not here, David. Pride at Work, Mike Andrew.
Pride at Work votes yes.
Thank you. Pro-choice Washington, Sammy, he may have had to leave. We had him vote.
Let me,
earlier.
Sammy is at another function. She texted me to let us know that she voted yes, and we can affirm that for anyone if they need some fine print.
Okay, thank you. That's a yes vote. Passara, David.
Yes. Puget Sound Advocates for Retirement Action, yes.
Okay, the Retired Public Employees Council of Washington, Gwen.
RPEC votes yes and has already voted to pay $500.
Great, thank you. Save Secular Health Care, Washington, Susan Brooks Young.
Save Secular Healthcare Washington votes yes.
Thank you. Seattle Indivisible, Paul Oldenkamp.
Seattle Indivisible votes yes.
SEIU 1199 Northwest, Ada Lynn.
1199 Northwest votes yes.
The Somali Health Board. And Mohammed also confirmed before he left that he voted yes on this also. UAW Local 4121, Sam.
We vote yes.
Washington Insulin for All, Jessica.
Insulin for All abstains.
Abstain. Okay. Washington Community Action Network, John.
Washington Can votes yes.
Washington Federation of State Employees, Cindy Hall.
Yes, Washington Federation of State Employees vote yes, and we already voted to donate $2,000.
Thank you. Washington Poor People's Campaign, Ming Chen.
Washington Poor People's Campaign votes yes.
And I have the last two votes on that.
Jim, I think you didn't call on the Healthcare for All Washington, I don't think.
Ronnie? I thought I did.
You did, but,
We did,
but
yeah, we got
I
Ron.
always like to vote twice. You know, that's
Oh.
what the mayor of
We're
Chicago
recording.
suggested.
Don't even joke like that. We'll get
You voted early and
Yeah,
often.
be a smoking
My
gun.
apology, my
Sorry.
apology.
Okay, well, just give us a second here because I just have to count up the non-votes.
All right. While we're
As you count the non-votes really quickly, I just want to thank everyone on behalf. It's just amazing. Thank you so much. And I want to be very clear. The $1,000 that I'm donating is on behalf of my sweet angel mother, who lived to be 103 due to preventive care, and she was just an angel to me. So I'm making it in her memory, this donation, because she's an amazing lady. Isabella Ramirez Sanchez. Thank you.
Thank you, Jesus. Wow, thank you very much. This is tough because I want to say a bunch of stuff from the heart too, but so really, I'm really warm. My heart is warmed by everybody who's really gotten through this with us, and especially those who have come forward and really supported this in a really big way. So thank you. We also want to highlight, it's in the chat. I am not sophisticated enough right now to screen share it better than that. However, maybe I am. Actually, wait. Okay. There it is. Okay. Sorry, I've got so much stuff on my screen. We're asking folks to call the Congressional Switchboard. This is vitally important. This time of year, the smelliest votes go through DC, but then in some ways they're the most important. And in this case, there's an omnibus bill that is approaching that we need everyone to call the Congressional Switchboard, 202-224-3121. And I'll tell you why. We need to ask our members of Congress and senators to stay in session for the rest of the calendar year to pass the omnibus 2023 budget to fully fund our social spending programs, including health programs in the next year. If we don't get an omnibus bill, we could have a year-long battle to adequately fund vital programs, and effectively, we would be giving the power to the incoming Republican majority to hold those folks hostage who benefit from those programs. So please call 202-224-3121 I just got a text saying, and I wish it would showed up on the screen. 202-224-3121. Asking your members of Congress and senators to stay in session for the rest of the calendar year to pass the omnibus 2023 budget package to fully fund our social programs, including health programs in the next year. Of course, you can see that in the chat as well. Thank you, John. Please copy paste what's in the chat if you need to do that after this meeting. So thank you. And yeah, okay. Jim, do you happen to have the vote ready?
I do have the vote ready.
Great.
We, on the question of the budget and dues proposal, we have 37 voting yes and 1 abstention, for a total of 38, and 2 of the votes from the earlier vote had to leave.
All right. Well, we thank you, Jim. We've got a couple more things to go over. Have some announcements to make about co-chairs. And yeah, first of all, thanks everybody for moving this agenda forward. One thing so what I want to do is, first of all, take a moment to really thank David Loud and Claude Burfict for their time as co-chairs on our steering committee. They are stepping down effective December 31st. Claude, it's been a real honor to work with you and to march with you. And David, man, you already know. So for everybody else, David is, at least in my experience, the most prolific organizer I've ever been around. And it just means the world to me that he's worked with me these last 4 years. And I will do my best to honor him and carry the work forward. And yeah, and lastly, I just want to say for both Claude and David, when I've talked to my friends and my people in my circles about the people I work with, I talk about all these amazing people, but just to be able to say that I work with you guys brings me a lot of joy and pride. And it's why I show up for this work. So anyhow, we got some new co-chairs too, and they're really great. Ronnie Shore from Healthcare for All Washington. He is going to be a co-chair going forward. Ronnie, did you want to make a quick intro for yourself, please?
No.
All right, that's fine.
I think we should move the meeting on, but I'm just so glad to have this coalition working together. It makes everything that we do individually so much more important. And it feels good to be climbing on Claude and David's shoulders and hanging out with you, Nathan. So thank you.
All right, thank you. And I'll do a quick intro for Sammy Alloy from Pro-Choice Washington. She's also going to co-chair during the legislative session. And we brought those two folks on, Ronnie and Sammy, very intentionally. Healthcare for All Washington has been a really strong ally in universal healthcare for a very long time. And we wanted to make sure we're really well positioned to put universal healthcare front and center in our work going forward. And then when we get into more micro issues, we really wanted to recognize all organizations. But when I looked at the platform that, and when we looked at the platform that Pro-Choice Washington has in this moment where women's, so many women's issues are under attack, it's really vital that we're bringing a lot of those forward, but also into other stuff like the Keep Our Care Act. That's a really vital piece. So that's some of the reasons why, and we're really glad to still have Sam and Emily moving that work forward in the policy committee as well, and bringing all of it together. And lastly, it's Kelly Powers. Kelly's stepping down at the end of the week. She got a job at the it's escaping me now, but Kelly is going back to work. And when I think about Kelly's work, it's exemplary, always reliable, always quick to respond, and coming from a place of passion and dedication, conviction, and yeah, similar to what I described with Claude and David. Kelly, we are really going to miss you. And I don't know if I mentioned it, but Claude and David are staying on the steering committee, so they will be around. And yeah, that about wraps up my announcements. And I don't know if I'm going to be able to get the slides back up.
Don't worry about it.
But yeah, thank you very much, everyone. I'm going to hand it to Cheryl if I can.
Okay, thank you, Nathan. We want to thank you for your support and your engagement, and we know that the key to making progress towards our goals is building the strength of our coalition and our movement. And with that, let's open it up for the good of the order. Raise your hand using Zoom reactions.
Thanks, Cheryl. Hey, everybody. Amy Leong Sheher. I'm the organizer on staff with APALA Seattle chapter. I'm happy to share space with everybody here and excited to work with you all moving forward the next year. Just for good over the order, just want to see if this is appropriate for us to share a quick project APALA is working on, and would love for you all to share your input. Quickly, APALA has been contracted with the City of Seattle's Office of Planning and Development and the Seattle Department of Transportation to survey our community members about what is important in the future and what is the City of Seattle should be looking like. We want to make sure we emphasize on uplifting those who have been not at the planning table and make sure we get the feedback from our community. So if y'all have some time, feel free to share your thoughts in a survey I'm about to drop in the chat. And, love to hear from you all in your community. Thanks, y'all.
David.
I just wanted to mention that PNHP Washington's third Wednesday, January meeting is going to feature Dennis Kucinich, who's a player on the national stage, who's going to be talking about prospects for moving healthcare forward in the coming legislative session.
Thank you. Well, if we have no other hands raised, thanks everyone. Good night, and look for a newsletter wrapping up 2022 and action alerts and newsletters from us in 2023. Aho.
Thank you, Cheryl.
Thanks so much, Cheryl and Gina and everyone. Thank you.
Thank you, everybody. Good work. Heading strong into 2023.
Happy holidays, everyone.